Assalamu alaikum. Hello everyone. Most of you know me. My name is Abdulrahman Tamimi. I'm a fresh graduate from University of Sharjah Medical College. If you haven't followed me, this is my Instagram, dr_al-tamimi with a double I on the end. So before I start explaining, please make sure that I am just making your studies easier. I'm not covering everything about the respiratory system. Go back to your book and read more about it. Let's start. I will just get straight into it. I will not give introduction. What is the respiratory system? We all know that it helps our body get oxygen and expires carbon dioxide. So let's just get into it. Okay, so the anatomy of the respiratory system. We have first the nose, and then we have the pharynx, and then we have the larynx. And let me draw them to you. This is the nose, and here we have something called the oral cavity, which is the mouth. And behind the nose we have the pharynx. So this is the pharynx, and this is the pharynx. And over here we will have the larynx. So the larynx is over here. Under the larynx we will have the trachea, and then the bronchi. And then we will have the alveoli, or the alveolar sacs, or the lungs. So this will be the trachea. And then the bronchi. There are multiple branches of the bronchi. We will discuss them more later. And those are the alveolar sacs. We'll discuss them more later, which will help for the lungs. Okay, all of this is the respiratory tract anatomy. We will get into details more about it in a few minutes, or in many minutes. You have to know that the gas exchange only happens in the alveoli. So oxygen gets into the blood and carbon dioxide gets out of the blood here, right here. There is an artery over here, or there are capillaries over here, and there is blood inside, and oxygen gets inside and carbon dioxide gets outside in the alveoli, not in the trachea, not in the bronchi, not in the larynx, not in the pharynx, not in the nose. So how come all of those are part of the respiratory system if they don't participate in gas exchange? Because they are conductors of the air, or they are conductors of oxygen. They will help transport air from the outer wall into the nose, into the pharynx, into the larynx, and until it reaches to the alveoli, and it will make sure that the air reaches the alveoli will be in a good condition. It will be warm, it will be filtered, it will be moistened. So you have to know this as well. So there are parts of the respiratory system that will not function in gas exchange, but they will act as conductors of air to make sure oxygen reaches here in a good shape. Okay, so in this video, we will talk about the only part of your respiratory system that you can see, which is the nose. Because you can't see the lung, you can't see your trachea, but you can see your nose. So this is your nose, okay? And in here are those two, which we call them the nostrils. The nostrils will allow air to enter the nose. And above here we have a bone. It's called the ethmoid bone, and here we will have something called the palate. I will talk about it in a minute. But here we have the nostril. So air will enter the nose through the nostril, or the nares. Okay, once it enters the nose, it will be inside the nasal cavity, which is inside the nose, or the anterior cavity of the nose. Okay, so this is the nasal cavity. The nasal cavity is divided into two parts, right and left. It's divided by the nasal septum. So there is septum here, and there is right, and there is left nasal cavity. Okay. What else? You have to know about the nasal mucosa as well. When you talk about the nasal mucosa, you have to remember two things. One of them is olfactory receptors, and the other one is the respiratory mucosa. The olfactory receptors will be located superiorly near the ethmoid bone. Olfactory receptors are receptors that will help us to have the sense of smell. Okay? So if a question in the exam has came in, or you had a question in the exam and you were asked, where are the olfactory receptors are present? It's not in the trachea, not in the lung, not in the bronchi. It's present in the nasal cavity superiorly near the ethmoid bone. It helps us in the sensation of smell. Okay? Olfactory receptors, nasal cavity. The rest of the nasal cavity or the nasal mucosa are respiratory mucosa. And you have to remember three things about the respiratory mucosa, which is very easy. Remember veins, remember mucus, and remember cilia. Okay? So the veins will help warming, or will function in warming the air that is coming inside. Okay? It's thin-walled veins. The mucus will help in trapping the bacteria or the foreign particles that are present in the air. And it also has lysozymes, so it might kill the bacteria that is present in the air. The cilia will help in swiping away or sweeping away the mucus that this mucosa is producing. During winter or cold temperature, this cilia might be sluggish, or it might not function very good. So the mucus will start building up in our nasal cavity, and it will start dripping, and we will be embarrassed. So the cilia will help in swiping the mucus away posteriorly, so we can swallow them. So remember three things about the respiratory mucosa: thin-walled veins, lots of mucus, and cilia to swipe away the mucus. Also remember that in the lateral wall of the nasal cavity, so let's say this wall is this side. Here we have a septum, right? We took away this side, and then we had a septum, and then we took it away. Now we're seeing this wall, which is the lateral wall of the nasal cavity. There are three elevations. We call them the concave. Those are elevations, 1, 2, 3. Those elevations will help the air that is coming inside to be turbulent, not very smooth. It will help the particles to be in touch with the mucosa and whatsoever. But you have to know or focus or remember that the concave are three elevations in the lateral side or the lateral wall of the nasal cavity, which will make air that is coming inside to be turbulent, which will help in making sure that the air is being in touch with the nasal mucosa. So nasal nose mucosa, then we will write here concave, and let's talk about the palate. The palate, you have two parts. You have hard palate and soft palate. The hard palate is supported by bone, and the soft palate is not supported by bone. It separates the nasal cavity from the oral cavity. Here's the mouth, and this is the nasal cavity. Oral cavity, nasal cavity separated by the palate. That's it. Very simple. Soft, hard. Okay, very easy. And yeah. You also have to know there are two things that drain into the nasal cavity. Remember the sinuses and the nasolacrimal ducts. Nasolacrimal ducts. The sinuses, for example, let's say here we have a bone, and inside this bone we have a small hole which contains air and mucus. It secretes mucus, but this mucus inside this hole will be drained into the nasal cavity. And the nasolacrimal ducts are tear ducts found in the eye, but they drain into the nasal cavity. The sinuses will function in making the skull lighter. It will act as a resonance chamber for speech. However, if there is inflammation of the nasal mucosa, such as rhinitis, the draining of those two into the nasal mucosa will be affected. So those two might be affected as well. So we will have sinusitis. So you have to put those two in your mind. Thank you very much.